Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. So as all my loyal listeners know, I spend way too much time on Twitter. But it's not all for naught because I meet some fabulous people on Twitter. And during the midterms, I got very consumed with the fact that most of our elected officials did not know much about healthcare. And in fact, one of the few things that Donald Trump has ever said that I agree with is whoever knew healthcare could be so complicated. So I was thrilled when I met on Twitter Dr. Kathleen London, who is running for Senate, United States Senate, from the great state of Maine. And Lord knows we need somebody fabulous who knows about healthcare from Maine. Let me tell you a little bit about her, and then I'm going to let you tell you a lot more about her. She graduated first from Brown University, then did further studies at Stanford University before going to medical school at Yale University. She completed her residency in family medicine at Oregon Health Sciences University and was subsequently a professor at Weill Cornell School of Medicine in New York City for 5 years. Then she moved to Brookline, Massachusetts, where she was a clinical instructor at Boston University and Tufts University Schools of Medicine in her spare time. Are you getting the gist of what I'm trying to impress upon you? We have a overachiever on our hands. And maybe that's my bias. I tend to interview a lot of overachievers. But for the past several years, she's owned and operated a medical practice in Millbridge, Maine, her home, where she treats over 1,000 patients. Now, she has worked with Doctors for America, serving as a state director, and she's currently the women's delegate from Maine to the American Academy of Family Physicians. She's also on the legislative commission of the Health Commission for the Maine Medical Association and serves on the Maine Democratic Committee. You may have seen her on all the major networks as a medical contributor, but today you get to see her in the ladies' room with Dr. Donica on our podcast, and we are thrilled to have her. Welcome, Dr. London.
Oh, thank you so much for having me, and welcome to my humble abode in Maine. This is how I look at the end of a day of seeing patients and dealing with my 4 rescues.
Well, please give us a tour. I understand we caught you in the midst of dinner.
Yes. So my younger son is dating a lovely young girl from India, and she brought me spices.
Wow.
From India. And I've been afraid to use them because they call for like these huge, you're cooking for like a crowd of 20. And which I love to do, by the way. And Thanksgiving was like that.
I can see all your pots in the background hanging from the ceiling.
Oh, it's not all of them. Shh. There's more here.
So this is a first in the ladies' room. This is the first time we've gotten a tour of someone's kitchen while we're talking to them. And this is the first time we've had a nutritionist on our show, but even she wasn't actually cooking while we were talking about food.
While we're talking. So I'm known for my multitasking. Ask my sons. So they have heard me do radio interviews when they were little. Mm-hmm. So the same son at like 4 or 5 could say oligomeric proanthocyanidins and would go into his school doing that.
It was like my son when he was in 4th grade, and they had this homework assignment where, each day they had a homework assignment where they had to do 10 vocabulary words with whatever the letter of the day was, and then use that word in a sentence. So they were up to the letter O, and his words were ovary, obstetrician, ovariectomy, oophorectomy, and other things beginning with the O. And the teacher wrote a note home saying, "Is there anything I should know?"
He had heard me do this radio interview for polyphenolics and grapeseed extract, and had heard the words so many times. They chimed it off in school. It was great. So I decided
what are you making?
So I'm making butter chicken masala.
Oh.
And can I tell you how easy it was when you have the spice mix, the real thing? So I basically cut up some chicken and sauteed it, put it aside, then did the onions, chopped up an onion and put it in. and then threw in the spice mix and let that happen. Threw in some strained tomatoes and some cream and threw the chicken back in, and voila.
Voila. So too bad you live so far away, or I'd invite myself over for dinner. But I have to
absolutely. I love that. Yes. Just
all of our listeners want to know, how do you have time to run a practice and take care of over 1,000 patients and do all of these amazing civic activities and have 2 children and 4 rescue dogs and still make time and to cook dinner from scratch?
So yeah, this is that whole thing of man makes plans and God laughs. My whole life has been that way. So actually New York you got the order wrong. Boston was before New York, but that's okay. So I had planned, so med school happened because—
I'm a native New Yorker. I always put New York first.
Yeah. So I had picked careers that would let me stay home when I finally decided I wanted kids, which wasn't until my 20s. So I was I was working as a software engineer. And so Stanford happened because I had not done my pre-meds undergrad. I was a theater and computer science major because everyone does that combo, right?
My daughter did theater and neuroscience.
There you go.
And when
that makes a little more sense.
When people ask her what those 2 things have in common, she says they're both studies of human behavior.
There you go. So mine happened. I actually dropped out of college 2 weeks before senior year. My parents were thrilled because I was working in the film business in New York City, and I didn't see that when you're going back. What got me to go back was special effects. I actually did my master in fine arts at NYU in set and costume design. And I got into special effects during that time, went back, doubled up my major because I wanted to do 3D animation work, and spent an extra semester working for a professor, took a job as an engineer, knowing I wouldn't stay one, but knowing that computers were part of our future. And this was in the 80s.
Wow.
So, and during that time, I wanted to build a human body on the computer.
Okay.
This was about 89, and nobody was doing this work. And I started volunteering my time at Stanford, and one of the doctors, who I did not particularly like, said, well, if you want to make tools for doctors, why don't you become one? And that kind of stuck with me. And I'm Jewish, so I was given that doctor's kit at 2, and that kind of never went away. And so I started volunteering at San Francisco General Hospital, and the rest is sort of history. I knew it's what I needed to do. And so I did my pre-meds at Stanford, and applied to medical school and went. So I met my now ex-husband during that time, and I was going to take a year off between medical school and residency and have a baby, only I didn't get pregnant. Okay. Until ready? No, you can't make this up. The day after I signed my contract for residency. Seriously, no, you can't make this up. I signed the contract and I got pregnant. I'm like, what? And then because it can only get worse from there, the weekend I stopped breastfeeding my then 15-month-old, I got pregnant again. You'd think I would know how that works. I am a doctor after all. But apparently we didn't figure that one out. And
so
looking
I did the same exact thing, not in terms of the first one. I waited till after residency, but I got pregnant with my second one. It must have been 5 minutes after I stopped nursing my first one, because I never got a period between my first and second children. But since I'm an OBGYN or trained in OBGYN, I knew that was a possibility. And my now ex-husband and I had a conversation about it. And I said, it's possible that I could get pregnant right away, but it took me so long to get pregnant with the first one. I'd rather that they be closer than further apart. And so my kids are 16 months apart.
I can look back at my call schedule. We had sex once. And so that's
you
really
remember. I'm sure I had sex lots of times when I was a resident that I don't remember.
Oh, no, I was sleep deprived and everything else, all of that. But so I was an Orthodox Jew, so I went to mikvah. And the night that my second was conceived, I called the mikvah because I finally did get a period. And I called the mikvah and they were closed. Now, this is not a good thing when you're a religious Jew. And so I actually went in the Willamette River.
Oh my gosh.
And so I got to wear a big t-shirt because it was not a private place. So my son, my now toddler, is in the car strapped in. My husband is laughing hysterically at me. And I go in the Willamette. You're supposed to dunk 3 times. I dunked once and said, no, that's it. So yeah, no, the night of his conception, I remember very clearly.
You didn't have a bathtub?
And I was on call when I did that pregnancy test, and it was only like 7 days after I conceived him. And I'm like, there's no way. And I'm sitting in the VA bathroom with a test that I snagged from the ER, and I went, are you kidding me? Seriously? I was just like, this cannot be happening. And I just told my residency director, no, we're not going to have any more right now. No. And then I had to go do the walk of shame into his office to rearrange my schedule.
And isn't it horrible that that's a walk of shame? You know, that.
Right. No, but that's how it is. Oh my God. I mean, seriously, the places that I pumped are obscene, you know, just when I think back on that, you know, because we're now talking, my boys are just turned 21 and 23. And the places that I had to pump to feed my children, there was no privacy. I remember with my first, we put a sign on, it was the room that interns did notes in. Mm-hmm. And we just put a sign that said moo on the door. To warn male co-interns, and it was like, you know what, get over it. You know, this is what I can
tell you, if your kids are 21 and 23, mine are 23 and 25. And between the 25-year-old and the 23-year-old is when they finally developed a reasonable breast pump. But for the 25-year-old, that breast pump was archaic. And I really did feel like I was, you know, in a painful milking machine. So at least that.
I did the electric one that you could determine how much your finger determined how long it sucked. In between, the hand pumps came out.
The hand pumps were horrible.
No, I had a really good one. The Advent hand pump came out with my second one, and it was a godsend because I could write notes while I was pumping.
So I usually ask guests their most unusual experience in a ladies' room, but where's the most unusual place you ever pumped breast milk?
Well, doing rounds.
Okay, during rounds.
I'd sit there. I mean, I literally had to use a nursing bib and do rounds with a bunch of men around me, and I'd be pumping. And they just sort of sit there like, yeah. Mm-hmm.
That's talented.
When I say I can multitask, I can multitask.
You can multitask with the best of them. So what is your most unusual experience in a ladies' room?
Okay, New York City, gotta win on that one. You know, everybody thinks that trans is a new thing. It's not. Mm-hmm. So yeah, seeing some very tall, transgendered person come in. So I guess it would be a trans woman, though I think they still had boy parts.
But you wouldn't know because we have stalls.
Right. But walking out to somebody much larger than me with very large feet and not knowing quite what to make of things. And I was young and naive and didn't really know what to do with that.
Well, I actually had an experience like that when I was in medical school. There was a guy who was a year ahead of me in medical school who took a year off to transition and then came back. And this was the first trans person I ever knew. And he came back as a woman with a story that she was a transfer from another medical school, and she was transferring because she had a bad breakup with a boyfriend. And if she's listening to this, what I would like her to know is the reason that all of her female medical school classmates were upset had nothing to do with her being trans. It had to do with the story of saying that she had to transfer medical schools because of a bad breakup, which is not something any of us would ever do. But she walked into the ladies' room once when I was in there in a onesie. And in a onesie ladies' room, that's always embarrassing when anybody walks in. So I had not completely locked the door. So that was an awkward moment. So tell us, how do you go from being a multitasker and from having 2 children while you're in residency and then doing all this amazing medical stuff to running for Senate? How did that work?
So I mean, it's part and parcel of like why I moved to Maine. You know, here I was doing in major cities, doing, you know, always with an academic affiliation. I have done advocacy work the whole time, you know, so with Doctors for America, with lobbying. gone and, beaten my head against the wall in Washington. I am a single payer advocate. I do think healthcare is a right. I think our system is so messed up. And I've said since I entered medicine, I graduated med school in 95, and I've said since then that I think things are going to get worse before they get better. And that's been true. I never thought the ACA was an ideal bill.
And by ACA, you mean Affordable Care Act.
The Affordable Care Act, also known as Obamacare. I think its original iteration was certainly better than what happened, and then it's been decimated over the years by what's been done to it. The public option would have been good. So many things would have been better than what happened to it. It was the best bill that could get through that Congress. Having said that, do I think insurance companies are evil? Yes. And that's with a father in the insurance industry, just never health insurance. They do property casualty. So my whole family, except for me, went that route. My father's a very
Maine, how long?
I've been in Maine 3.5 years.
Okay.
3.5 years.
And so what motivated you to move to Maine?
So I wanted to come to a rural underserved area. And there I am at Weill Cornell, not happy. My boss has dropped all insurance, including Medicare. And I wonder, how can you be a professor how can you be affiliated with a teaching institution and not take Medicare?
All right. And for those who don't know, this is in New York City, because we have listeners around the world in 32 countries, I might add.
So that didn't make sense to me. And I was more and more unhappy. And was it my job? Was it, what was it? And and I got, as many doctors do, I got spam email all the time. And one of them was for a job that sounded great. And it happened to be rural Maine. That one happened to be for the top of Maine, Fort Kent, which is at the very, very, very tippy top of Maine. And that didn't scare me. And I had a fantastic phone interview. And this was in February of 2015. And so my boys and I flew up in the middle of a snowstorm, landed in Presque Isle and drove up. When the boys saw the snowmobiles going 100 miles an hour, they were like, yeah, let's go. It was great. And, we would pass territories that were undeveloped. And I thought this was amazing. So I had a fantastic interview. The recruiter lied. What a shock, right? He said, exactly the following September I would start, and he's like, they'll wait for you. No, they needed somebody right away. And so I said to my sons, they're going to pick the guy who's less experienced than me because he can start right away. And I can't. I couldn't just leave a practice.
Right.
And I was right. I mean, it wasn't that simple. They deliberated for about 10 hours. But it made me go, well, what else is out there? And for the very first time in my life, I put my name up on one of those search sites. I put my CV up, my curriculum vitae. My phone ran off the hook. The fact that I was willing to go rural, oh my God, I had no idea the demand was out there. But it was good. It made me look. I looked at upstate New York, Vermont, New Hampshire, and Maine. The only thing I had known about Maine prior to that was southern Maine, which is very much like Boston North. Mm-hmm. And that wasn't what I was looking to do. So there was this whole other part of Maine I didn't know. And I very quickly narrowed it to Maine. And I looked at where I am now, which is Washington County, and the county that I'd started looking in, Aroostook County. And Washington County quickly won because I'm an ocean girl. Mm-hmm. I really love the water. I've always lived on the water. And I've always dreamed of having a place on the water with my own beach. And that's what I have now.
Now I'm definitely inviting myself over.
Anytime. And I originally took a position in a town called Calais, which is right on the Canadian border. It looks like Calais, and I speak French, so to me it should be pronounced Calais. And the fact that we don't pronounce it that way offends me every time I hear it. I think it's Calais.
You can't say things like that when you're running for Senate.
I know. Well, but it is French origination, and they took the British saying. So I don't understand that. It doesn't make sense, and there's a lot of French Canadians there. So I think they wanted to pronounce it Calais as well. So I don't understand it. It doesn't make sense, but that they would go with the
New
British.
York, we have West Houston Street. So
right. This is true. This is true.
And in Delaware, they have Newark instead of Newark.
Right. So I started out in Calais, and then I took it because I really liked the CEO of the hospital, and then he quit 2 weeks before I got there. I was like, what? So that ended up kind of falling through. I was there for about 6 weeks, and then I took a position at a federally qualified health center and stayed the usual 4 months that people stay there, and then started my own practice. But the FQHC got me to find the house that I'm currently living in that I rented until I bought it. and I started my practice, and I literally started going door to door until I found office space, which is how my practice got its name of Door to Door Doctors.
Oh, great.
And and now I only do house calls on people who really need it. Like last night, I did do a house call on a woman who has an advanced stage of cancer. So I do house calls in those kind of cases. And it's real rural medicine. We're an hour from the nearest hospital. And I love it. I see everything. It's truly what we call cradle to grave or womb to tomb. I do a lot of urgent care where I'm removing foreign bodies from various parts of people, to diabetes, to, their hypertension. No, Angel, it's not dinner time yet, sweetie.
Yet another puppy makes its appearance on our podcast. Do you do deliveries?
I did, when I was in Boston, I used to do OB. I don't anymore. I do full office GYN, but
because this is a huge problem. A huge problem in rural medicine is, when pregnant patients are more than an hour from the nearest hospital, or in many places, way more than an hour.
It's very true. I mean, if an emergency walked in, could I deliver? Yes. Do I keep an emergency OB kit? Yes. But most of my patients are beyond that time. I get the babies. I have a lot of kids in the practice, and I do full office GYN, including colposcopy and all of that. I do a lot of IUDs. I do terminations. I do.
If you do a lot of IUDs, you'll have fewer deliveries to worry about.
So yeah, I try to keep them from needing, that option. And, no, we've had, hospitals close doing their delivery services. Calais, the first hospital, stopped doing OB. And those women have to travel.
What did you do?
Two of them are playing. Yeah. So we have two playing. That's Stella and Angel, my first two.
Hello. Sit, Stella. Sit, Angel. We have had a lot of dogs make appearances on this show. So tell us.
Those two were in the New York Times with me on the EpiPen.
I'm sorry?
Oh, stop. Those were the two who were in the New York Times with me on the EpiPen alternative.
Got it.
Designed an alternative to the EpiPen that's cheap.
And what is that?
By taking an auto injector design that's already out on the market and using that. So it's about $50 to put together the original one, and $5 or less to refill.
And that's the engineer in you.
Yeah.
So how did you go from all of this to now running for Senate?
So it's that same need of service. Since getting up here, I met with Susan Collins before the AHCA vote that was a year and a half ago. And
which is basically Trump care.
Right. And she was receptive, and and she did come out against it, which I was very happy to see. But since that time, she turned around and kind of sold us out. Where she, that tax scam vote where she supposedly had this guarantee, and where was that? And all of us were kind of like, really? You've been in Washington 22 years. You really want to
for that?
Come on, you're not that naive. I know you're not. And all her votes since then, and so. And Bruce Poliquin, who actually just got defeated, is my other representation. He doesn't even bother to answer phone calls. He doesn't meet with anybody. So not even in my role as the Maine State Director of Doctors for America. So I kind of sat there going, I don't have representation. So when
Maine is interesting. Your congressional, there's only 2 congressional districts in all of Maine. Right. Is that correct?
Correct. And I live in the red part of the state. Mm-hmm. And so this started out on Twitter as a joke. this idea of running.
As so many things do these days.
Right? So when Kennedy announced his retirement.
And by Kennedy, you mean Supreme Court Justice Kennedy.
Supreme Court. Correct. Topher Spiro tweeted out, "The Dems in Maine should put up a strong woman now." So Esther Chu, who you might know on Twitter, she's an emergency. Another Yaley, thank you. She's at OHSU, my alma mater for residency, and she's an emergency room physician. She's like, "Hey, Kat, how about you?" And I'm like, "Oh,
she's my favorite tweeter."
So,
by the way, I want you to call her and tell her I want her to come on the show and talk to me about gun violence. I need an ER doctor to do that.
Yeah, no, we definitely need that. And so I tweeted back, "Yeah, haha." And then somebody else, another doc that I know down in DC, who I've been down on lobbying trips with, Doctors for America, tweets at me, "Hey, Kat, how about you? With all your policy work, blah, 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 blah." And I'm like, "Oh, come on." I'm sure, yes, District 1 might go for me. I don't know about District 2. And this gets a little like Twitter discussion going. And then the next day, our lovely sellout Susie comes out.
And by sellout Susie, you mean Senator Susan Collins.
Senator Susan Collins. That's her nickname, actually, officially on Twitter, is sellout Susie. There's a lot of hashtags with that. She basically says that she's not going to use Roe v. Wade as a litmus test. Now, you have to understand that she got elected in our purple state with a pro-choice stance. Mm-hmm. Pro-choice groups have gotten behind her all these years because of that, because she has been a staunch supporter of women. Oh, where'd you go? Hang on, come back here. There you are. And I was totally offended. And so I got on Twitter and said, maybe I should run. Well, that kind of gets everybody going, mm-hmm. including Topher Spiro, who goes, "Go for it." Mm-hmm. Well, all this chatter gets a reporter to call my office by the name of Steve Collins, who writes for the Sun Journal in Lewiston, and that also gets printed in the Press Herald. He calls my office and he says, "I'm on Twitter and you sound like you're about to announce." And I said, "I'm upset with the state of our politics. I am offended that, it's kind of everything we just sort of said." And I said, democracy demands that if nobody else is going to step up, that someone needs to step up. And if no one else is going to, then I guess that will be me. He said, "I think I'm going to run a story." This is back in June.
He wanted the scoop.
He drops that story on a Friday night at 8 p.m. Topher Spiro tweeted it out by Saturday morning, there were 6,000 hits. Mm-hmm. And I went,
6,000 hits or 6,000 likes?
Likes.
Right, which means many more people saw it.
Right. Just 6,000 likes of that one tweet. On a Friday night, this is like not a time, that's like the time you sneak a story out, right? So now I just come off of we had just done, we were ramping up for midterms, right? We had just decided, on the Democratic side who we were putting up for governor and everything else. And I had worked on some of the other campaigns advising on healthcare. And so one of my cousins in Florida said, "Well, what if you ran just to pressure her?" Meaning, on the Supreme Court thing. And I said, "Well, that's an interesting idea." So I call up somebody from one of the campaigns from governor. And I said, "Well, what about that idea?" And she says, "Are you kidding? You'd be an amazing candidate. Your story, you give everything up and you move up here to open a practice, you could win." Mm-hmm. And so then I have to start thinking about this, like, for real, do I want this? Like, I never have wanted this. I've never wanted to be in governor, in any kind of government position. I've liked being the advising person, the policy person. Like, I will advise you on healthcare issues. I'm happy to be that person. So that has been my role. I've never wanted to be that candidate, no, or a legislator. So I had to think, do I want this? Like, what happens? What happens if I win? Like, what happens in practice?
Then like my city.
And my patients. What about my patients? I have a job. So I first find out that, okay, I can put the practice into a blind trust as long as I don't benefit. Well, I don't now, so that works. I have not taken salary yet, so yeah. And other people have already stepped forward to help. That's the rice.
I was wondering what that was. I'm hearing noises in my ears.
It's my rice cooker.
There are downsides to multitasking.
And I've had other people turn around and say that they would help on the practice. So that answers that dilemma. And I start thinking, well, there's so many things that are healthcare related. Just how our healthcare system is, that we need to fix that. Enough. We need to actually solve this. We need some sort of single payer. Whether that's Medicare for all or we go with France. I have written about this numerous times. There's so many ways to solve this, and I'm willing to cross the aisle and solve this. The opioid crisis is just being made worse by legislators because they don't know what they're doing. They're not doctors. And get out of my exam room. Stop talking about doing anything about abortion. Get out of my exam room. You and I could sit there and name 50 conditions that happen at 20 weeks that they know nothing about, everything from tuberous sclerosis to, everything else that they don't know because they didn't go to medical school.
Well, forget that. What I learned, which was really shocking, I overheard a conversation the day after the presidential election at my gym, where it's 4 men bragging about how they succeeded in preventing women from ripping babies out of the womb the day before 9 months, which is what Trump had said in the last debate. And my first reaction was anger, but my second reaction was, okay, let me just approach this calmly. And my attitude about conversations in the gym is if they're loud enough for me to hear, they're loud enough for me to join in. So I said to them, do you know what a legal abortion is? Do you know how many weeks that is? And they did not. And instead of being angry, I said, let's actually have a conversation where I actually educate these men. They were all over 40. They were all fathers. Not one of them could tell me how many weeks pregnancy was. And this would be a very interesting study to do a survey of all of Congress and ask all of Congress some of these basic questions. Like, do you know how many weeks a normal pregnancy is? Do you know the number of weeks after which no abortion is legal in the United States of America? And that's 24 weeks, which is viability in most places. I actually did a survey, a very informal survey at the American College of OBGYNs meeting about 10 years ago, where I asked every single OBGYN I ran into, which was well over 100, if they had ever seen a quote unquote late-term abortion. Because late-term abortion is not a medical term. That's just not a thing.
We don't call it that.
We don't call it that. One person out of 100 had ever seen one. Because what it's called after 24 weeks is a delivery. We deliver the baby. We deliver the baby, and then we usually save it. And what the other thing most people don't know about abortions between 20 and 24 weeks is that the overwhelming majority of abortions between 20 and 24 weeks, which is only 1.3% of all abortions, the overwhelming majority of abortions during that time are done for horrific fetal abnormalities that are incompatible with life. They have nothing to do with the mother changing her mind or the mother even having a serious medical problem. And in fact, I often see and often hear of the opposite situation, where when mothers have severe life-threatening medical illnesses and they're pregnant, they go to horrific lengths to save the baby and not to have any medications or any chemotherapy that would save their lives until they can safely deliver the baby, which is usually about 30 weeks. And they wait, and many of them die as a result of that. And that brings us back to maternal mortality increasing in the United States. Is one of the only developed nations in the world where that's true.
And infant mortality.
I'm sorry?
And our infant mortality rate is also going up.
Yes, as our infant mortality, absolutely. So I love the statement by the late Senator Ted Kennedy about abortion, who said, a woman is perfectly able to talk to her elected official in private without the involvement of her doctors. Why can't she talk to her doctor in private without the involvement of her elected officials?
Exactly. Well, and this is near and dear to me because I unfortunately lost a pregnancy at 20 weeks, a very wanted pregnancy. It was a court accident. There was nothing wrong with her.
And by cord accident, you mean an umbilical cord accident. So there was compression of the
there was
umbilical cord.
there was a knot in the cord. I was, this was the long weekend. It was Labor Day, and I knew something wasn't right. And this was still when I was doing obstetrics. So I went home. We were done visiting family, and I went home to Boston and tried to get heart tones, and I couldn't. And I waited to the next day to call my OB because I didn't see the point of calling her at night. So she sent me over to the hospital. We did an ultrasound, and it must have just happened, and they straight away induced me. So there I was on Labor Day being induced, and delivered my daughter, Sarah. And we did an autopsy, and everything was fine. And I buried her. And my first day back in the office was 9/11.
Oh my God.
So for me, 9/11 is fraught with all of this. And my milk came in and everything postpartum. It was horrible. And I think about if they passed a ban, I would be forced to continue to carry until I went septic. Okay, that's the reality of these laws.
Let me just, as painful as this is, let me just connect the dots for people who don't really understand what you're talking about.
Yeah,
so
and I'm happy to explain. Yeah.
So she was no longer living inside.
Even though this baby had died, I would not have been able to be induced because they would call it an abortion because I was over 20 weeks, even though the baby was no longer living until so a dead baby inside of somebody is dangerous. The mother, you can become infected, but it's not considered. If we say that we can't do an abortion unless it's a danger to the mother's life, you have to wait till the mother has actually gotten infected. So there I was, visibly pregnant to everybody. I would have had to carry around a dead baby inside me. And if you think I'm kidding, there was a state lawmaker, I think it was done in Georgia, who actually said that. He said, he compared women to farm animals. And he said, it's tragic, but we deliver dead calves and dead pigs. And I really couldn't believe it. This is on tape somewhere because I saw it online. I saw it. He said this on the State House floor. So we were compared to farm animals. And I would have had to go along with people asking me, when are you due? And me saying, oh, she's dead. And I can't think of anything more horrific than that. I really can't.
That's horrible.
Because, Sarah was very wanted. Very, very, very wanted. And like you, the only times I have referred anybody for a termination late in the pregnancy have been for things not compatible with life. And that these lawmakers would interfere with those decisions that are so tremendously painful.
Painful and complicated and individualized. My very first delivery that I ever did as a medical student, I got to scrub in on this C-section because I was the one who discovered that this woman was not pregnant with twins. She was pregnant with conjoined twins. And these two babies shared a heart. There was no way that they could survive. And between them, they did not even have a functioning brain. But she was 31 weeks. So we did a delivery, and we had to do a C-section because of the size of the conjoined twins. And they were delivered, and they were held, and they were loved, and they lived about 48 hours until, they passed. And it was horribly traumatic for me. So I can't even, as this medical student, so I can't even imagine how this mother, navigated this whole process. But in the backdrop was a group of so-called concerned citizens who were trying to get a court order to maintain these conjoined twins on life support. So, and at the same time, this mother made the incredibly heroic decision to donate the organs that were donatable. So there were 3 lungs that were functional. There were 2 corneas that were functional. There were 2 livers. So, this was, but because of her decision, Several other children, went on to have, wonderful, productive lives. And yet there was this group that was trying to intervene. So these are all complicated issues that are highly individual. I would love to see more physicians in Congress to actually give some knowledgeable experience. Unfortunately, we have some physicians in elected office who make the most outlandish, uneducated, ignorant statements. So in one of the debates, Senator Rand Paul, who is a trained physician, made a ridiculous comment about vaccines. I'm sorry?
He's an ophthalmologist.
Right. But he should still know about vaccines. Or maybe he was absent that day in medical school. I am delighted that Donna Shalala has been elected to Congress. She's a past secretary of the Department of HHS under President Clinton. And so even though she's not a physician, she certainly is extremely knowledgeable about healthcare administration. And I wonder, at what point did knowledge and experience become not so important in elected office?
So this is the thing that scares me, is that, like, even up here, something I didn't anticipate in moving to a rural area, or this particular rural area, my education is treated as arrogance. And I'm like, what? So you're saying because you made it through 8th grade and I went on to get a doctorate, I'm arrogant? How does that work? And that seems to be spreading. And no, it's not equivalent. I'm sorry. Those of us who actually go on to try to learn about things, that should be respected. I'm sorry.
Which doesn't mean that somebody with an 8th grade education can't have a tremendous degree of knowledge in any particular area, but not medicine.
My fishermen, 100%. My lobstermen, many of them don't have education beyond high school, and some of them not even that, but boy, do they know fishing.
And there's plenty of people who've dropped out of college who've gone on to run Fortune 500 companies.
Absolutely. But yes, when it comes to
medicine. But you can't do that in medicine.
No. And whether vaccines, et cetera, I think those of us who actually study science know it a little better than, say, an actor. I don't understand that. And that's a phenomenon. That's where it's a false equivalency, and it doesn't work, and it does break down. And I find it personally shameful that you can have an opinion that doesn't make it a fact.
And the distinction between facts and opinions have gotten very blurry, as though that's somehow debatable. That's the beauty of a fact. A fact is not debatable.
Right.
An opinion is debatable.
And we need to get back to some of that. I am fine with having discourse. I am fine with, let's come together and solve our common problems. Mm-hmm. I am fine that my dad and I are very different politically. He's very right wing. He's very Republican. I'm not, clearly. And yet we can sit down and try to solve something together. Some of it we're not going to agree on. And so it's going to be tougher. But we can agree on where the common problems are.
Well, and you can agree that it needs to be discussed. And you can agree that to solve any problem, whether you ultimately agree or not, to solve a problem, there has to be some degree of compromise, or it's not solved. So I think one of the issues you mentioned, you threw about a bunch of terms. And one of the terms we hear a lot about is this concept of Medicare for all. Given that we've already established that there's a tremendous amount of confusion about our healthcare system, please explain to people very simply what Medicare is.
Okay, so Medicare is the program that all of us pay into out of our paychecks.
All of us who are employed. Correct.
Out of our paychecks. That's why I said out of our paychecks. So if you're employed, part of your paycheck is put away. That FICA, that thing that says FICA, that's you're paying in for your future. or when you, so retired or you're disabled, that's Medicare. Okay. So that is, it was a program established in the 60s, and that money, so it is not in that sense an entitlement program that, it's money that you paid into for your future.
So it's a federal insurance program for people who are eligible, and people who are eligible are generally people who are over 65, people who are disabled, people who are completely blind, and certain children. Some children.
There's dual eligibility. Yeah. So disabled usually fall under dual eligibility. If you're under 65, it would be what we call a dual eligibility, which, because they get Medicaid and Medicare.
So explain to people what the difference is between Medicaid now and Medicare.
Okay, so Medicare is this federal program. Medicaid is our program for those for poverty, and it is a state-run program. We do have feds kicking in some of it now. It is, so it's different state to state of how it's reimbursed and everything else. It's usually much poorer reimbursement, though it does have extensive benefits. Like my state is definitely a state that did not expand, in spite of the fact that the voters voted for it and everything else. It has been.
Okay, so explain that to people. I don't think people really understand what happened with Medicaid expansion and how some states decided to accept it and some decided not to. So what was that all about?
So when Obamacare passed, when the ACA passed, part of it was we were going to expand the eligibility of people who could receive Medicaid benefits
by raising the income limits.
Right, the income limits to above, how much above poverty. And so a lot of states decided not to do that. That was what they sued. They went to the Supreme Court to say, we don't want to do this. And those are the states that have struggled.
And why would they not want to do that?
Because they were usually red states, and they just thought that's a good question, because they thought that
looking a gift horse. They were looking a gift horse in the mouth.
They thought it was fiscally irresponsible.
Right, and they were cutting off their nose.
So Governor LePage thought these are able-bodied people who should be working for themselves. They need to have skin in the game. These are the terms that I'm using of his.
And do you know what percentage? Do you know what percentage of Medicaid recipients have severe chronic illnesses or medical disabilities?
Quite a big.
I know it's a big number, but I honestly don't know what the percentage is. I'm sure it varies state by state.
Pretty much all of them, but his ruse is that the majority are working. That's what's interesting. Like, I've got patients who made too much to get Medicaid, so it's almost a disincentive to keep working, because then they lose their main care. And these are people with children and everything else. So it's really.
So this is the other issue about Medicaid, is that it has different names in each state. So you have Maine Care, Tennessee has 10 Care. There's different names for it, but Medicare is consistent throughout the country, whereas Medicaid varies state by state.
And the benefits are going to vary state by state. Like some states have dental benefits, some states do not. Some state, so it's the benefits of Medicaid vary state to state. Medicare does not. Basic Medicare does not. Now, there's also these plans you can buy in on Medicare. Those are different. And that's the whole privatization side that I'm not for. How insurance companies make money off of our Medicare dollars. And that's a whole nother discussion.
That's a whole nother show.
So Medicare operates at a 5% overhead. Insurance companies run at a 20% and higher overhead.
And what about Medicaid?
Good question. That's, again, state to state.
So I would think the biggest difference clearly between Medicaid and Medicare are the eligibility criteria. The second biggest difference is Medicare is federal, Medicaid is state. But I think the third biggest difference is that most physicians in private practice, and most physicians who take insurance, take Medicare. Most physicians
There's a huge difference in reimbursement.
do not take Medicaid.
So I lose money on Medicaid. When
And you can't make that up in volume.
No, you can't. I mean, I literally lose money on those visits. I still take it. I lose money on those visits. It's the reimbursement support. I mean, I'll see a complicated patient who takes me 40 minutes and they'll give me $26. Like, are you kidding?
Mm-hmm.
I still have to pay my staff and the electric and everything else. Like, that doesn't get discounted for me. So centers do better because they get this other fee and there's all these games that get played. I can't do that. So there's the complications that get to this or beyond this discussion. So there's one thing we could do is expand the eligibility age. We could say we can allow people to buy in on Medicare. Like right now, because I'm in a state that didn't expand, didn't start their own exchange, and we're a small state and an older state. I went from getting, reasonable healthcare in New York to up here. The best I could do is I'm paying $1,800 per month, and each of me and my children have a $5,500 per person deductible.
Wow. And
that's better. It was $6,200. Ooh.
So I actually,
and I haven't looked at next year's rates yet.
I think I shared this with you. I was actually thinking of running for Congress. And my idea was to just run purely as a physician on healthcare, which of course in our district is the number one issue people care about, as same way across the country. But my whole issue was going to be wrapped up into one sentence. And that was, physician runs for Congress in order to afford health insurance for her own family. Because I'm paying $1,000 a month just for me, and my daughter pays separately. And that doesn't include, vision or dental or, any of those other things. But I only have a $4,000 a year deductible. So your situation's worse than mine. And I think this is
where, thank God I have a dispensary in the office, and for my patients without insurance, I do direct primary care. So I don't bother going through my insurance for my meds. I dispense them directly myself because it's much cheaper. And my labs, I don't bother going through my insurance because I have a contract with Quest and it's much cheaper.
My insurance doesn't cover labs at all, zero. But I think this discussion is also really interesting for people who are employed who get a paycheck, because they don't realize, I think they think the only uninsured people or the only people who are affected by this ACA issue are people who are unemployed. But it's the millions of people who are self-employed and the millions of people who work for companies that don't provide health insurance or who aren't making enough money to be able to buy into health insurance or aren't working full time. So it's a huge...
So up here, people are blaming Obama for this, but it's not Obamacare that's the problem. It's the states that didn't expand. It's the way the exchanges were set up. It's the insurance companies that got greedy and saw a way to make money off of it. It didn't have to be this way. I'll just leave it at that.
And because they didn't include a public option. Yeah, my solution was set a fee where somebody like me could just buy Medicare.
Right.
And that fee could be $1,000 a month. It would still be better for me to buy Medicare and pay for Medicare at $1,000 a month than it is buying my private insurance, because I'd have better coverage. And I think that gets us back to, what does this position, Medicare for all, mean for America?
So what people don't understand, they think that we'd have to do this other tax and, we can't afford it. All that money that's currently going to private insurance companies, which is paying, take a look at the CEO salaries, okay? Mm-hmm. Take a look. And that money is going to CEO salaries, and it's going to shareholders and everything else. All that money would then go into the system. The money's in the system, it's just misspent. That's what we need to get across to people.
Well, so that money, what it also means, and this is, I think, is really important, what it would mean is whatever Congress would decide that it would mean. And this is why it's important for us to send knowledgeable people to the Senate and to the House so they can figure out the details of what it means. And the details might be that people who are self-employed could purchase Medicare, regardless of their age. And we just get a bunch of accountants in a room to crunch some numbers and figure out what they would have to pay based upon, their age and their financial circumstances. It might mean that we have a separate public option. I feel like we don't need a separate public option. We already have a really good public option.
Right. We have a really good one. Exactly. Maybe we're going to do something like France does, where you have, some sort of copay with it, or maybe, there's so many iterations around the world for us to be looking at. We can't just keep doing nothing. That's
so when I was applying for medical school and I was interviewing at SUNY Buffalo, which is where I wound up going, one of my interviewers asked me an interview question. And the interview question was, if you had unlimited time and unlimited resources, how would you solve the healthcare delivery crisis in the United States? And this was in 1985, by the way. And I took a deep breath and I thought for a second, and I just kind of panicked. And I said, well, first I would have to actually really spend a lot of time thinking about it and researching it. And he pushed his chair back. He was a really serious guy. And he started laughing. And he said, I have asked every single student I have interviewed that question every single year. And you're the first one who ever said she'd have to think about it. Welcome to UB. And he said, we want medical students who think. And that's the thing. This is not going to be an overnight solution. There are lots of easy little things that could save a lot of money that you and I could list, that could be fixed immediately, that don't have to be part of a 1,500 page healthcare, package of legislation. And that was one of the things that I was thinking is, can we just go after the low hanging fruit first and then deal with all these bigger picture issues? But I think what people need to understand is that Medicare for all is a slogan, and it's an aspiration, and it's an idea with no details underneath it. The details are what we have to think about, and what we have to talk about, and what we have to have hearings about, and what we have to get experts involved with. And that's where we have to hash out the ideas and the thoughts and the pros and the cons and find out what all these things will cost. But the other thing I want to let everybody know, and we would be committing podcast malpractice if we didn't mention this other huge difference between Medicaid and Medicare. And that is, if you look at customer satisfaction surveys for people who use Medicare versus people who use Medicaid, people who use Medicare are overwhelmingly happy with it. People who use Medicaid are overwhelmingly unhappy, to the point where there are actually millions of people who are eligible for Medicaid who never register. And one of the things we don't know is why that is. I actually asked my congressman that, years ago when he was against the ACA. I said, well, has anybody ever surveyed these millions of people who are uninsured to find out why they're uninsured? And he looked at me like I had two heads. Like, why would we want to know that? Yeah. So, and these are the things that, doctors have an orientation towards, is we want data. We want evidence. We want facts. We want information. We want the lab test results and the x-ray results and the family history and the personal history before we make a diagnosis. We want to gather all that information. And I think that what I love about your candidacy most of all is that that's how doctors think. And I would love for our elected officials to start thinking that way. Like, let's gather the information first before we tweet about it. Rather than tweeting first and then trying to scramble and figure out how we're going to accomplish, what somebody just tweeted about, which may or may not be a good idea in the first place. So what other issues are passionately important to you as a Senate candidate, other than healthcare, which is, of course, number one?
Right. Well, on the heels of that, obviously, sensible gun control. I am a gun owner. I live in the middle of the woods, so I'm not trying to take everybody's guns away. Let me make that clear. But having said that, that doesn't mean that I needed to walk out of the store with 2 long guns and 2 pistols the day I walked in. Longer waiting periods, better background checks. We track Sudafed. Why don't we track ammunition? No one has answered that to me. I don't get it.
And do you have an AR-15?
I do not. No.
Does anybody need an AR-15?
So the answer I get on that one, because I live in the country, where some people have them, they're fun. So if there's so much fun to shoot, how come we can't keep them at the range? Why do you need it at home?
Where I live, bowling is very popular here. And most people keep their bowling shoes at the bowling rink. And ice skating is popular at rinks. And most people don't own their own ice skates. They just rent them and they're kept at the ice skating rink. I absolutely agree with that suggestion. But I also look at data. And when we had an assault weapons ban, which was not renewed in 2008, we had far fewer mass shootings. The last time I checked the data from this year, and I apologize, I didn't have a chance to look it up 5 minutes before this interview because I'm sure it's changed. But on the 310th day of this year, we had already had 307 mass shootings. And a mass shooting, so that everybody knows, is defined as 4 or more people being shot. Yeah, that's insane.
It's insane. And I want the CDC, I want the ban lifted on studying. I mean, that's absurd.
So most people don't know that there is an actual
ban on studying gun violence.
The dangers of gun violence and the health effects of gun violence by the Center for Disease Control in the United States. And there's been, speaking of Twitter, there's been this, whole, outrage on Twitter because the NRA told doctors to butt out of gun control, saying this isn't your lane.
Just stay in our lane. Yes.
The NRA actually told doctors, stay in your lane because they think that gun violence is not a medical problem. Are you kidding me? First of all,
who do they think they got to do without?
First of all, who do they think treats all of these people who live to make it to the hospital? We always talk about how many people die from gunshot wounds in the United States per year. And I think now it's up to 40,000, which is almost exactly the same number as women who die per year from breast cancer, by the way. But they don't talk about the numbers who live after being shot. And they don't talk about and we're not allowed to talk about the morbidity after being shot because we can't study it. So we don't have the data of how many people have gait abnormalities or speech abnormalities or brain dysfunction, or how many people per year are wheelchair bound or need full-time care or can no longer work or who can no longer watch American Idol on television. How many people can't
We need more more red flag laws. We need more red flag laws, which is the majority of those deaths are suicides. Suicide, as most physicians know, suicidal feelings pass. But if you have easy access to a gun, you've acted on it before those feelings have passed. I ask, look where I live, most people have guns. So I do ask, are they locked up? Mm-hmm. Especially if there's kids in the house and everything else. Are there trigger locks? Are there this? Are there that? Those are routine questions. I'm asking them about their gun safety.
Right.
And they're appreciative of it. They don't think, they know I'm not out to take their guns. They know I own it. I have a gun safe. It's outside the house. It stays locked up. That's just, but at the other hand, the reason I have them, we have coyotes around here. I had one of my dogs was attacked by coyotes, a whole pack. When I heard them howling, the shotgun came out and stat loaded by the door because I didn't know what was going to happen. We have bears. We have other things. Yeah, I live in the woods. These things happen.
And I don't live in the woods.
When I lived in New York City, I didn't need a gun. All my predators were two-legged and there were police everywhere. So I don't have that here. The police here will be an hour before they're here, if they're on that night.
So my first choice gun control law that I want to see is just outlawing bump stocks. To me, that's the low hanging fruit. Second would be outlawing high capacity magazines. Nobody needs that.
Which in Maine, we don't have those. So Maine doesn't have high capacity magazines. There's a limit.
Would be an assault weapons ban. However, then we get into
the more.
I'm sorry.
So I understand the issue with the term assault weapon is a lot of guns can be modified. So I understand where people who own guns talk back on that one, which is why I haven't used that term when I talk about gun safety and gun control. So I'm more along the lines, that's why I've gone after, why don't we track ammunition.
Mm-hmm.
I definitely agree with limiting magazine capacity. And we, because it's too easy to modify an existing weapon,
Mm-hmm.
I have some issues with turning around and just saying we're going to ban this weapon.
That's one of the things you can work out when you're in the Senate, and you can discuss that, with your colleagues.
Right. But we need waiting periods. We need better mental health. There's so many things that we need to fix that we can't keep saying, oh, thoughts and prayers, and we can't do anything.
Well, we need a nationalized computer database so that somebody who lives in one state and has a record of domestic violence offense can't go to another state and get a gun and then come back and shoot their ex-spouse. But the other thing I would like to see is this issue of accountability. So if one of my adult children takes my car or borrows my car, and God forbid is in an accident, and God forbid, naims somebody or kills somebody, I'm responsible. My insurance is responsible. Similarly, I think if you're an adult and your child gets access to your gun or takes your gun, you need to be held legally responsible for that. And I feel like, that also would go a long way to getting people to take much better care of locking up their weapons. But we could talk about gun control all day long. What's your next issue? Big three.
The environment.
Absolutely. The health of, I was hoping you would say that, because that is also such a health issue. It's the health of our planet.
And we need to be investing in alternative energies. That's also going to help our economy and everything else. And this reliance on fossil fuels is ridiculous and killing us. So.
Awesome. Any other burning issues?
Those are my biggies. I mean, obviously there isn't an area that I don't have my finger, thinking about. And we need to play nicer in the sandbox of the world. And know who our friends are and who our enemies are.
Keep your friends close and your enemies closer. So how are we going to get you to win now? How do you wind up continuing to practice and see 1,000 patients and do a statewide campaign in a state that's geographically as big as Maine and yet has a relatively small dispersed population?
So I'm going to start by going at, getting all over the state as much as I can. Right now, fundraising is big. I've got an end of year goal coming. The more that I can show that I've raised, the better I look as a newcomer to the scene.
So how can our listeners donate to your campaign?
So I have both an Act Blue and I have a crowd pack. I have both. But if you go to spelled out, drcatlondonforme.com. That will,
and that's cat with a C.
With a C, yep. You can link right from there. And I'm also on CrowdPack. I've got both of them on Twitter. My Twitter has the links as well.
And where can people find you on Twitter?
Dr. Cat, DRCAT, the number 4 me. Dr. Cat for me. It's nice that Maine is
not just for me, but it's for Maine. But the other Twitter story that I love that happened immediately, actually even before Susan Collins voted for Brett Kavanaugh for Supreme Court Justice, there was this movement that erupted on Twitter. I honestly don't know who started it, creating a fund of money that people could donate to that would go to the Democratic challenger to Susan Collins if she did not oppose Brett Kavanaugh's nomination. And she did not, despite the fact that he had clearly shown himself to everyone who watched on television that he did not have judicial temperament. If we look at no other issue, and he clearly—
that was what I said. That whether he did anything that many years ago or not, his temperament is not the correct one to me.
And quite honestly, as the mother of 2 young adult children, I can say he did not have the temperament to be 8th grade class president, and certainly not president of the high school senior class. So
correct.
The temperament issue was a huge one. So there's this pot of money, and my understanding was that in 48 hours after Kavanaugh's nomination or confirmation, they raised how many millions of dollars in that pot?
It's close to, well, it's now almost $4 million, and that's going to go to whoever wins the Democratic nomination in 2020. So I need to get to that nomination, and I need to win it.
All right.
It's going to be needed. Susan Collins spent $6 million when she was a popular incumbent.
Wow.
So that money's going to be needed.
I think
money's
that's
going to
the
be
thing
needed.
that people lose sight of is how much money has to be raised to mount a successful candidacy. So we're going to go let you focus on that, and we're going to let you go. But one of the ways we're going to help you is we are going to circulate this podcast episode far and wide. So tell everybody again where they go to donate money to your campaign.
Okay, Molly, you're not really helping. Molly, quiet. Hey, Molly, quiet.
Molly's trying to answer the question.
Yeah. Dr. DOCTOR CAT CAT London LONDON 4FOR me.com. Dr. Cat London 4me.com.
We will print that in the intro to the segment. Thank you so much for joining us. We wish you every success, and please check back in with us anytime.
Thanks so much for having me.
Thank you for joining me in the ladies' room.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.